morning. Welcome, everyone. My name is Diana Granita. I'm a rheumatologist based in California, seeing patients all over the United States. And I'm one of the direct specialty care rheumatologists. And I'm also the founder of Direct Specialty Care Alliance, which is an organization that is supposed to educate other physicians like you about direct care and growing the movement in a very educational way, I would say. Today, I have the pleasure to have as a guest Dr. Becky Kaufman-Lin. She's a gynecologist, but she's also the founder and CEO of Evora Women's Health in St. Louis, Missouri. Dr. Lin founded Evora in 2020 after she has been in academic practice for 10 years and another 6 years in private practice. Dr. Lin specializes in menopause, sexual health, and weight loss. And she started a very comprehensive, holistic approach practice that offers time and attention, the attention and the time that every woman deserves. She graduated from Georgetown University in Washington, D.C., and she did her residency at Washington University in St. Louis. And she also has an MBA from St. Louis University. Dr. Lin, welcome. And I'm very, very grateful to have you here.
Thank you, Diana. I'm really excited to be here. I'm just really excited to share how everything, share the knowledge that I have that I didn't have 2 years ago when I started Evora. So yeah, thank you for having me and thank you all for coming.
I think this is the first start. We did not have a lot of knowledge coming from academic practice and private practice, but as we transition into direct care, we found out that we can learn and evolve and change things the way that we wanted, and we do find solutions. My first question to you was, or will be, why direct care? Why did you decide to transition in direct care?
So there are so many reasons why I left academics. You know, I had been in practice for 20 years before I left and started Evora, and I have seen medicine change for the worse. You know, I saw how our visits got shorter and shorter. My employer double and triple booked me, and I just felt like I couldn't practice medicine the way that I wanted to practice medicine. It changed in front of my eyes, and I didn't have time for my patients. And I didn't realize how burnt out I was until I wasn't burnt out anymore. So like I would, you know, see patients all day long, chart all night long. You know, it's you guys are probably familiar with this system. You know, I can remember sitting on the couch and one of my kids was like, could you help me with my homework? And I was like, no, I have to chart. And I'm like, oh my God, I can't even help my child with their homework. And I also, you know, I felt like I had no control over my schedule. I had no control over anything. The academic center that I was at dug themselves a nice financial hole. And in order to get out of that hole, which I had nothing to do with that, they took away research time, they took away teaching time and academic time and put in more clinics, which I understand from a business perspective, they had to put in more clinics because that's where the revenue comes in. But I was like, why am I even in academics if I can't do my research and I can't teach? And it was just, it was, you know, just so many reasons that I decided to leave.
But how did you find out about direct care? Because the world that we know, or the world that is surrounding us, is the world that we learn to be in residency.
Right. So I had heard about direct care. I'm a sexual medicine specialist, very involved in ISSWSH, which if you're interested in sexual medicine is a great organization. And there were several people in ISSWSH who stopped taking insurance. I hadn't heard the word direct specialty care or direct primary care. I did not know that term. I had heard of like concierge medicine, but I remember because I was kind of like to myself, I was like, why would anybody pay when you can just go to your gynecologist down the street? And I can remember a couple things that convinced me why that was okay. And I still have people today ask me, why would anybody pay to see you when they could go to their gynecologist? And I have a whole long list of reasons. And obviously, I'm still in business, so there are plenty of people who are willing to.
Oh, sorry. Just a second. I think we, by accident, can you speak now?
Yeah.
Okay, I think by accident I tried to mute someone and I mute you. So
That's okay.
now you can talk, please.
So I remember I saw a patient and she said, oh yeah, well, I saw a sex therapist, and she was like, and I paid $400 to see that sex therapist and she couldn't help me. And I was like, if you're paying a therapist $400, why can't you pay your physician for their time? And it seemed so obvious to me at the time, but now in retrospect, after having been in practice for 2 years doing this, it is hard to convince people. People are not used to paying their physician. But when you provide that extra value, they're like, oh yeah, this is so worth it. Like, I can reach my doctor. My patients have my cell phone. I answer their messages. We get people in same day, next day. We really provide that value. And then they see the value that is, direct care, as opposed to my old practice where you had to go through a call center. Nobody could reach you as the physician. There's always that wall, right, between the patient and the physician. Even today, for me, my primary care doc is regular traditional medicine, and I can't ever talk to him. I only talk to the nurse. But so that's how I ended up doing this.
It's very interesting that you said that, because this is the first step that we have to understand. We have to make the patient understand why they have to pay us, because there is this misconception that they pay the insurance and the insurance pays us. They do not know what is happening behind that. And just because they carry a card or an insurance health or a health insurance card, they believe that they have access to care. And when they need that care, they figure out that they don't have the access to care. How did you prepare yourself to answer such challenges in terms of the question of the patients? Did you prepare I would say like a script that you can tell the patient? Did you put your thoughts down? How did you evolve to be free to say those things to the patients? Because that's a barrier that most of us have.
Mm-hmm. Well, first of all, I think as physicians, we so undervalue ourselves, which just drives me crazy. So I feel like you really have to, say with confidence, here's why I'm worth it. So as far as a script goes, it's kind of like your elevator pitch. How are you going to sell yourself when people call? And I've learned that honing an elevator pitch takes time. So when people would call in the beginning, it was just me, and I would answer the phone and, talk about it. And then I hired an assistant. It was just the two of us. And both of us kind of honed that elevator pitch over time. And it definitely changed over time. And we practiced it with each other. Because you do it and you're like, oh, we should have said this, we should have said that, and now it's pretty well honed and it's very different from how we started.
Can you give us some keywords?
Yeah, so here's one thing that we do now when patients call, we get I think this is a good tip. So we keep track. So this is for marketing yourself. We use Constant Contact. We have a newsletter. And when patients call and they say, oh, I want to see Dr. Lynn, we used to be like, oh, okay, well, she doesn't take insurance. So then people would like, oh, forget it, zone out. Yes. So now we get their name, we ask who referred them, how did they hear about us, which I think is super important because we need to know if the marketing that we're doing is working. How did they hear about us? We get their email address, we get their information, and we schedule an appointment. And then we say something to the effect of, well, our practice is a little bit different. We don't take insurance, but there are a variety of ways you can get your visit paid for. We do give super bills in my practice. So we always say we'll give you a super bill. If you want, you can submit that to your own insurance for reimbursement. The only insurances that we know that will not reimburse are Medicaid, Medicare, and TRICARE. Or you can use a health savings account or a flexible spending account to pay, or Care Credit. We accept Care Credit, but we don't really have a lot of people who use Care Credit, maybe like 2 or 3 over 2 years. But that's kind of how we explain it. And then I don't do this, so I don't answer the phone anymore, but my assistant, she'll pause and like, because some people are like, oh, forget it, click. And other people are like, oh, okay. And then we just kind of, if they ask questions, we'll answer their questions. But that's kind of how we do it.
That's very, very, very helpful for many of the people that are here on the call and many people that will listen to this. I do about the same thing, and I was doing the same mistakes like you. I was
Yep.
starting was I don't take insurance until I understood that that's a huge, huge barrier for patients. And first you have to feel them, make them feel comfortable, maybe listen to them, why they are there, give them that kind of the confidence that they are in the right place. I even say, yes, I understand, or my assistant says, yes, I understand. There are many people like you that fail the traditional system, and you are here in the right place. We do take care of many people like you. So that's another thing, to make them welcome and to make them feel like they are heard and they have potentially found someone to help them. Because that's the other thing. When they reach out to us, they have exhausted other options. So that's very, very valuable. Thank you so much for sharing that. Now, we all have someone to talk to, like a mentor, like a coach. Did you have that? Or some of us don't.
Yeah, I'm trying to think if I've had a mentor or a coach. So I would say I don't have a mentor or a coach. But when I started this, I have a good friend who's a direct care gynecologist. She started direct care. Now she takes insurance in addition, but we both started about the same time. And so we would talk to each other from time to time, bounce ideas off. Like I follow her on social media, so I would see what she was doing. She would see what I was doing. We'd chat. But that's really it. Now it's interesting to me because people do have business coaches, and somehow, so my assistant, she came to me after undergrad as a pre-med. And I don't know like how I got so amazingly lucky. She's like 24, she's a kid. She is so incredibly smart business-wise. Sure. That she is my COO now. Like she has this business acumen that is wonderful. So like, for example, so I go to her now with business decisions and I treat her as an equal, obviously. And like, for example, we're in the process of hiring a primary care doc, and we were working on the contract, negotiating back and forth. And I went to her, name's Chloe, and we're like, okay, what should we do? How should we? And she was going to leave me one day because she's way too smart to stay in a small practice, right? But that's okay. I would rather have somebody super smart for the time being than someone mediocre. So she, as far as business decisions now, because I do have friends in business who have business coaches and hire business coaches. And I don't think I've ever really needed a business coach to bounce ideas up. I don't know. Maybe I do need a business coach. Who knows?
But you do have an MBA, right?
I do have an MBA. So
How did that help you?
Oh, absolutely. It helped me. I really do not think that you need to have an MBA to run your own practice. You don't have to. Okay. But I feel like the skills that I got from my MBA really helped me see it as more as a business, as, I can't really explain it, but like, how to market, how to show that there's value, how to look at it as a business. Because, I feel like as physicians, we're always like, oh, we don't care about the money. We just want to help people. But if you're going to start a direct care practice, you have to worry about the money. And I left a salaried position and I went to salary of zero. And I didn't pay myself for 9 months, and God love my husband for making it through because I cramped his lifestyle a lot. So, and we're still married, so that's a good thing. But, you definitely have to look at it as a business and know your value. And so I feel like that's what we've done. I do use my skills on a daily basis that I learned in business school. And the other thing that I do, which I love, so if you guys need some business help, right? Because as a small business, I don't have a whole bunch of cash to hire a whole bunch of people. So what I did, I graduated business school in 2019, and then I left my job early 2020 and started Evora. And so in business school, so if you have a business school near you, they do, before you graduate, you do a capstone project. And usually local businesses will come with a problem, and they want you to answer that problem. They want you to do the research on that problem and help them with the business, and it's free. So the first year that I was out in practice, I wanted some outside ears and eyes to help me. And so I did it twice. I had a group of business students who it was their final project to evaluate my business and give me suggestions. And it was awesome because they thought of things that I hadn't thought of. So I took a break from it, but I'm going to do it again this fall.
So this is a program, what is this? Is this a program for the business schools? You go and present your business idea and they comment on that, or they give you?
Well, it's a whole project. So like, for example, so when I was in business school, our project was a local shop, and she sold some clothes, but she did hair. That was her main thing. And her question was how to make more money, how to grow, should she stay in her location? And so our job was to do some research and give her an answer. So like, we did some polling. We looked at, incomes in the locale where she was located. We basically did research and said, well, here's what we think your business should do. And she didn't have to do it. She can take it or leave it. But the business students have time to do a deep dive into a question that maybe you don't have time to do.
I see.
And it was fresh eyes.
I think that's a brilliant idea, actually, because we tend to see or we tend to follow our vision, but we don't see sometimes parts of the reality of that vision. And the reality can be sometimes harsh on us. And we can learn faster with, some people on the side that are not emotionally attached to this vision. How did your vision change since the time you start? What was your vision when you start? And I know, looking at your practice from a side, that you have grown exponentially, I would say, and in a beautiful way, really in a beautiful way.
So it's so funny, because before I created this business, I knew what to do. I had a business plan, right? I had gone to SCORE, which is, it's free business advice, by the way, if anybody's looking to start up anything. So SCORE is run by the Small Business Administration. And I had a mentor. Oh, I forgot. He wasn't really a coach, but I'll tell you what he did. He helped me do financial projections for a bank loan. So I did use SCORE, and I took the business plan template and I filled it all out, and I spent all this time coming up with my vision and my mission, and here's how my business is going to be. And it is nothing today like it was then, but there's huge value in writing up that business plan. And if you use that SCORE template, because it makes you think about your competition and how you're different from them and what your own niche is. So I really liked that. But what I did is I responded to a need. So when I started, it was just me. It was just me and Chloe, my assistant. And then we started doing a lot of weight loss because, doing sexual health and menopause, I always had a lot of patients who wanted to lose weight, but I didn't have the training, right? As a gynecologist, I didn't know the first thing about weight loss medicines. And so when the pandemic hit, I came home and sat in this very room and didn't see anybody. And I was like, I've always wanted to learn weight loss medicine. So I joined the Obesity Medicine Association. I did all the online courses. They give you a mentor. I learned how to do it, but I didn't have a dietitian. And so one of my girlfriends, I'm a runner, we run together. She was a dietitian, and she was very interested in helping people lose weight and all that. So I was like, you should work with me. You should come work with me. So she joined us part-time. And then she got full. And so we had to hire another one. So they're both part-time. We have 2 dietitians. And then we needed a personal trainer because we created this weight loss program. We filled a need because there's nothing in St. Louis that has everything you need in a weight loss program in one place. And I know the local hospital, a patient of mine told me they called to get into their weight loss program. It's like a 6-month wait. And the thing is, when you're feeling motivated to lose weight, you better just like jump on and do it then, because by 6 months, you may not be motivated, who knows. But so we added personal trainers. And then the other thing that was going on is this was during the pandemic, everybody was chock full of anxiety and depression.
Yes.
And no one could get in to see a therapist. Like we couldn't find any. And I was like, gosh, Evora needs a mental health therapist. Well, we should get one. So I don't even know how I know how I heard about Indeed. One of my friends is an ER doc and she does a lot of little side gigs, and she's looked on Indeed and found like physician things. So I got on Indeed and I put an ad up for a mental health therapist, and I found somebody, and we have immediate openings in a time when you just couldn't find a therapist. So, and so as we've gone along, we've just added people.
Did you hire all these people? Or
part-time?
They are part-time, or did you kind of partnership with them?
They're employed part-time.
Employed part-time, excellent. So I have a couple of questions, and I'll take some questions in the meantime, but then we'll come back to my questions. One question is, how do you sign up to the Capstone the Capstone project business? Sorry.
So I would go to your local university, to the business program, and find somebody to email and ask if they have a capstone project for their business students. Sure. And if they have a capstone a capstone project, could your business be one?
Excellent. How large is your panel of patients?
Yep. So so what I do, I have a membership and I have fee for service. Mm-hmm. And I provide them both because some people need the membership and they see me a lot. It's worth it to them. Other people just see me for their annual once a year, and they just like the convenience of they can call and get in when they want to. So, so my membership now is probably about 70 people. And mm-hmm. then I have over 500 patients that are fee for service. Well, over 500, including those 70.
Excellent.
I think.
I do the same. So just to let other people say, because in rheumatology and in specialty, some patients will need us once or twice, or will need us infrequent, or some they just need a consultation, and it doesn't make sense to enroll them into the membership. But for some that, they have rheumatoid arthritis, in my case, of course, it's more financially viable for them to be on a membership model. So, when I started this direct care, everybody was thinking that it's only membership that will do the thing. No, you just have to be flexible and think about your specialty, your niche, like you said, find the need and then offer what is required, not only what you want to offer.
Can I say one thing about membership and fee for service? So the way that I have my pricing structured, it is more expensive per visit to do fee for service, because I want there to be an incentive to do membership. Because one thing that I've noticed is that the incentive when you're a member is to come to your visit. The incentive when you're fee for service is to cancel. And I hate cancellations. So on my calendar, the fee for service are pink and the memberships are purple. And when I see pink, I'm like, oh, half of them are going to drop off. People cancel left and right. And so I like having that membership provide stability. I know they're paying every month, no matter what. So I think that's important. I priced my fee for service higher than the membership.
I do the same. Now, how do you encourage them to go to the membership besides the pricing? What are the things that you include in the membership to make it attractive?
Yes. So this has evolved over time too, because, we noticed that most people would do fee for service, and we're like, what else can we do for the members? What else can we do? So for our members, we offer after hours and weekend appointments. And I'll tell you, nobody's taken me up on the weekend appointment, thank goodness, because I really don't want to go in. I went in once because my patient needed a COVID test, and I had COVID tests, and that really took 15 minutes, so not a big deal. But that's one thing. But we do offer discounts on every other service that we provide. So if you want a massage, we have a massage, we have an esthetician, mental health therapy, you get a 10% discount. So for people who are high utilizers and use our other services, it makes sense to be a member. Or our weight loss program makes sense to be a member because I check in with the weight loss patients every month. And then especially, I think people don't realize weight loss takes a long time and then you have some maintenance. So when we started our weight loss program, we didn't say, oh, the membership is the way to go, but in retrospect, that's really the way to go because weight loss takes a long time. We don't do fad diets. I am like 100% evidence-based academic medicine. Like I don't do beta HCG and stuff like that. So it takes a long time to lose weight. So, and then I do vaginal laser. And so they get a discount on that. And we sell products in our office. And so they get a discount on that. So if you're someone who's going to take advantage of all of our things, then it makes sense to be a member.
Now, for you in gynecology, you can offer some products. How did you choose what products will be something that will represent your practice? Because, for example, I do have people that they come and offer me to sell supplements. I did not engage into that.
Don't either.
Although I know that some might be valuable for the patients, but how do you decide what will be a product that will, generate you money, but will also be in good faith? And obviously, as you said, because I'm a science girl, you are a science girl,
Yep.
How do you make sure that that represents and stands to the standards of your practice?
So even before I started Direct Care, one of the products that I recommend, like I mentioned, I do a lot of sexual problems in women, sexual pain, genitourinary syndrome of menopause. I already knew that I liked a product called Uberlube. And actually, when I was at St. Louis University, we sold Uberlube in our office. And I think I had come across it at like meetings, conferences, and they give you samples. And I thought it was a good product. So that was one of the first products that we purchased. And then that's my favorite product. And then my other favorite product is a vaginal moisturizer called Rosebud. Well, it's the Rosebud is the brand name and the vaginal moisturizer is Honor. And the way that I found that, same thing, companies are smart, is I was at an ISWISH conference and they were giving out samples and I was like, this stuff is awesome. It smells really good. I know that sounds weird, but it smells like roses. And so I thought it was a great product. So we bought some of that and they send us samples, we give samples and we sell it. We also sell, in our office, we sell vibrators, just being a gynecologist and dealing with sexual health. So when we started, we did Pure Romance. And I really liked the Pure Romance products. They were moderately priced. They weren't like $300 for a vibrator, but I felt like they were quality. And of course, I looked at those at a Pure Romance party. But I ended up leaving Pure Romance because it's multi-level marketing and you have to buy a certain amount of product every 2 months. And so I did not like that at all because some months we'd sell a lot, other months we don't. And so I got out of that. Now I have a really bad taste in my mouth for multi-level marketing. And if anybody wants me to be involved in that, I'm like, no. Hard stop. Don't even tell me that it'll make me a whole bunch of money. Don't even mention it. I will never do multi-level marketing.
Now you are.
So we switched. We found different vibrators, which we really like.
Now I have noticed and I have followed you. You are very good about marketing and you are very good about social media. How did you learn that? And give us some tips for the people that are very shy to be on social media.
Sure. So I took a social media marketing class in business school. I learned so much. I learned so much. So I started with that. And I don't know. I think the pandemic gave me time to, learn how to do things, right? Like I went from 40 patients a day to 0. And so I was at home. And so I taught myself how to do Google AdWords and I taught myself how to change my website. I just had the time to learn that all. And then so I have a side gig going on too, Elara. I used to be Evora Med, but I had to separate the two businesses. I paired up with a woman that I met named Kate, who she worked in, big box advertising and marketing for 10 years in healthcare. And we do together, she has a team of people who do websites, social media marketing, Google AdWords, billboards, constant contact, all that stuff. And I do some business consulting on the side. And so working with Kate, I have learned so much more about what you can do with marketing. And then I also learned, here's another person that I learned from. So this is going to sound weird, but when I started, there was a guy who was a rep for one of the local pharmacies. And he would always come around and bring us lunch, and we all wore masks and everything. But he had a side gig himself of Facebook marketing, paid marketing, not just boost posts, but he knew how to do the whole marketing thing. And so he taught us a lot. And so we've just kind of learned along the way. And I've learned with Chloe, my assistant. And so, yeah, we've learned a lot.
Do you think social media generates patients, or will social media generate you patients, or what is the role of social media for us? I mean, because we have very different opinions about social media.
I think it helps. So you might say, well, nobody calls and says, I saw you on Facebook, right? But I'm fully believe in a layered approach to marketing, right? So if you just advertise, let's say you put out one commercial, people see the commercial, they forget about it. That's it. But they need to see you in several places. So they need to see your commercial, and then they're scrolling on Facebook and they see you. And then their doctor recommends that, that you go see Dr. Lynn. And so you need to have a variety of avenues where people keep seeing you and they're like, oh yeah, I'm going to go see her, because one time does a whopping zero. And I didn't understand that. So here's another thing. When I first started, I remember I met with a local newspaper called Ladue News. And actually everybody says print is dead. Ladue News gives me patients every single month. But that's my market. I don't know if that's true everywhere else. And when I first met with them before I started Evora, they were like, you should, purchase advertising for a year. And I'm like, a year? No way. That's so much money and it's expensive. And I'm like, no way, because how do I know that it's going to benefit me? I didn't know. So I did 3 months at a time. And I actually saw the benefit, but now I purchase it for the whole year. I don't pay all at once. I pay it each month. I do once a month. Because they keep seeing you over and over again. So now they saw you in Ladue News and they saw your Facebook and their friend goes to you. And so I believe in that multi-layered approach to marketing.
I had to learn that my way too, because you don't understand that the patient, or in marketing, they have these rules that they have to see you at least 7 times until they purchase something. It was very hard for me as a physician because I knew my value and I was proud of my accomplishments and my, titles. I thought that's enough, but my fellows here, it's not enough. They have to see you again and again, and I have to agree with that. What traction channels did you use to grow your business? Like you mentioned, social media. We mentioned here social media. Or the local newspaper. What are your traction channels?
Well, first of all, I am a type A overachiever. So
all of us
will do, like everyone who goes into medicine, I will do anything and everything. So I do, the traditional social media. I do Google AdWords. I pay for that. And actually lots of people find me on Google. And by the way, if you write blogs, it raises you up on Google. Yes. I do the traditional stuff. Then there's also a magazine called The Scout Guide. And I met with them, but they were really expensive. But then the owner of The Scout Guide came to me and asked if we could trade services. I'm like, hell yeah. I'm like, so I had free advertising, then she's my patient. No big deal.
Of course.
But other things that I do is I'm always looking to network. So I joined Business Network International. I don't know if you guys have ever heard of this. But what it is, you have chapters, and in your chapter, people are supposed to refer to you. So there's only one gynecologist in my chapter. In fact, there's no doctors. There's only one other pediatrician I know in BNI in St. Louis. And then there's other people, like someone who sells life insurance, someone who is a realtor. And the goal is to refer to each other. So that way you all know each other really well. And, you know, when someone says to the realtor, do you know a gynecologist? She's like, oh yeah, Dr. Lynn. So I spent a lot of time doing BNI, and within BNI, you can go visit other chapters. And there's probably like 20 other chapters in St. Louis. And it takes time. You meet once a week, but it is more than paid for itself. It costs $900 to join. And I was like, oh, I don't know, shouldn't I? But the person who runs it, she found out about me and she became my patient. I'm like, okay, well, that doesn't cover the 900 as of yet, but I see the value. And then I've just gotten more and more. And they take advantage because, like, really, I'm a gynecologist. Not everybody needs me, but people like massages, people like facials, you know, some people need marriage and family therapy. So BNI is good. The other thing I do is I'll always reach out to other physicians. I always volunteer myself to do grand rounds. Like last night, so here's an example of what I did. So one of my friends is a dermatologist, and she and I were running together one day, and she's like, oh, do you know Judy Gurley? And I'm like, no, I don't know who that is. She's a plastic surgeon in town. And she said, oh, she doesn't take insurance. And I'm like, oh, really? I'm going to call her. I want to meet her. So I called her up. And I said, you know, can we meet? And her staff said, you know, of course I couldn't talk to her. Staff said yes. And I went over there and I talked to her. And now she refers me weight loss patients, because women go to her because they want liposuction, but all their fat is visceral and liposuction isn't a good option. So now she refers to me for my weight loss program. And then just last night, we met for dinner, and I hooked her up with the adolescent gynecologist at St. Louis University, because she does a lot of breast reductions in teenagers. So we were like helping each other. So I do that. I do loads of events. I love events where we, you know, we'll advertise on social media or advertise on Constant Contact. You know, so here's an example. So one of my BNI chapter people sells makeup. So she's been doing makeup classes in my office. Doesn't cost me a thing. My patients come in. Once you get them in the office, you can be like, oh, did you know we had an esthetician? Oh, you know, you get to know people. I really believe in the value of getting people in your door, no matter who it is. And the more people that know about you, the better. So I do all sorts of little networking things.
I believe that that's the power of being independent, to connect with as many people as you can. And it doesn't necessarily mean that they have to be doctors, you know, because, you know, I say that, and I learned that from another friend of mine, Dr. Paula Muto. She said, doesn't matter how much we talk in the doctor's lounge, if we don't speak outside of that doctor lounge, nothing happens. So our mission is to actually bring patients to us that are not hooked on this idea that I have insurance. They have to be open-minded, and we have to help them. I'm really, really appreciative your advices and your talk here. I think it blows my mind. It is so helpful to all of these people that are here and many others that are not. Do you keep privileges to the hospital? Somebody is asking, do you keep privileges to the hospital? Do you still do surgeries in the OR? No.
No surgeries. Yeah, okay. I do no more surgery and no more obstetrics. Like, I really don't think I could do OB, and I don't really want to do GYN surgery. I love OB. I miss it. I love delivering babies, did it for 20 years. It's like part of my identity, but I, you know, don't ever want to go back to it because it's nights and weekends and it's stressful. And so I don't do it anymore. I'm on staff at St. Luke's, but I never admit anybody to the hospital. And I think, you know, part of it is what I do. You know, most of what I do really, you know, if you think about who gets admitted to the hospital, it's a lot of, you know, tubo-ovarian abscesses, hemorrhages, like, you know, either perimenopausal or post, anybody who's vaginal bleeding so much that their hemoglobin's really low that, you know, they get admitted. But I don't really admit anybody to the hospital, and it's never come up. And so for me, it's like too much trouble. And because then I'd have to like go to the hospital and make rounds and things. And I have a nice lifestyle now. And there is, I'm on staff at St. Luke's, and one of our former residents became an attending at St. Luke's, and he's trying to grow his practice. So whenever I have anybody who needs like a DNC hysteroscopy, I refer to him, because it's helping him grow and I don't want to do it anymore. So,
Very
yeah.
good. Somebody here is asking, do you offer expensive 500 plus in-office procedures? And if so, do patients submit the super bill to their insurance? And are they successful in receiving reimbursement?
I do 2 procedures that are expensive, and I tell patients your insurance will not cover this because they won't. So I do vaginal laser for genitourinary syndrome of menopause. I see many, many breast cancer patients because they get thrown into menopause and then they have sexual problems, low libido, vaginal dryness. So I do the femula vaginal laser. And here's what I've done for that, because these things to purchase are incredibly expensive. And here's another pearl, is that the reps will come by and here you are starting a business, you have no money, you're like worried, can I make it? And they're like, we're going to make you so much money. And they dangle that carrot of cash. Oh, and it cracks me up because like somebody came by, all these laser companies all want to sell you big machines. And they're like, look at all these people who make so much money in your area. And I'm like, yeah, but not all of them need laser, like, And so I think it's hard. You really have to have the right niche and the right demographic. People are going to pay a lot of money to do laser. So what I did, this wasn't my idea, but it worked out really well. One of my friends at the university, she had bought a laser and she was struggling to use it. She didn't really have the right demographic. And she said to me one day, hey, you want to use my laser? You pay me $500 a procedure and you can use my laser. And I'm a believer in laser. And I tried so hard to get the university to buy one. And you can imagine that didn't happen. So I was like, yes, because I love having that tool in my toolbox. It's not my first line choice, but I love having that option. So I sort of lease it from her. I pay her $500 and then I charge, now it's like $2,100, which is, it sounds like a fortune and it is, but that's the going rate because there's other lasers in St. Louis. So I charge about the same and I tell them insurance never covers it.
Sure.
So that's what I've done for that.
And one more question. How did you pick up your price point for the subscription model?
Yeah, it is such a good question because you're like, I have no idea what the market will bear, right? You have no idea. So I spent hours trying to decide, do I want to start low and then raise my prices, or do I want to start high and lower my prices? And I decided to start high because I looked at it as, if you're really cheap, people are going to be like, oh, she must not be that good. And so I was like, and I don't know if this was the right decision. I started high and nobody took me up on the offer, right? Because I was way expensive for St. Louis market. And so what I did in the beginning was I ran specials. I'm like 50% off, 40% off, 30% off. And I saw where it became a reasonable price and I was getting patients. So I settled on my prices where I saw at that discount, people were calling and scheduling. And I'm expensive. I realized I could not afford me. I would never go to me. I'm expensive. I can't have a concierge doctor, but that's because I started a new business and all that. So, yeah.
So, were you able to do, let's say, 30% off from the membership? Were you able to offer that?
No, it was fee for service.
Oh, the fee for service.
Yeah, so the fee for service, I think I can't remember, I did like 30%, 40%, and 50%, and that's kind of where I settled. So my fee for service for an hour-long visit is $499. And follow-up visits are $309. And actually, when we started, they were $299, but like with inflation and everything, I upped it to $309. My membership is, I started at $200, but I had a lot of high utilizers. And I was like, oh, this is, I have a lot of high utilizers. And I was like, and actually my capstone people were there like, I don't know if that's, sustainable. And so I increased it to 250 and now it's 259. So, and that's about, so around here we have MDVIP, we have Ms. Medicine, and there's about like 250 a month or somewhere around there. So I'm in line with other concierge providers. Now there are a group of DPC docs here that are significantly lower primary care. And the way that I look at it is I'm a specialist. So I feel like I can charge more than a primary care. And not only am I specialist, I'm a specialist within a specialist. You know what I mean? Because I do menopause and sexual health. So I've been able to do that. There's a cardiologist in town and he charges $4.99 a visit. And for the first visit, I don't know what his follow-ups are. And then my plastic surgeon friend who doesn't take insurance, she charges $4.99 for the initial consultation. So I landed on it by trial and error, but I feel like that's about the market rate.
Yes, I think it's a rate that is reasonable for a professional, you know, highly trained professional like you are. And I think that, you know, nobody makes or rolls the eyes when it's about to give this money to a lawyer or an accountant, but they start rolling the eyes for doctors. So they should appreciate that we are on the same line of professional expertise that we offer. And I want to remind everybody here the same thing. Don't undervalue yourself because nobody will value you. And you have to show them that you have the value and you are offering expertise and you have the training and you should be confident about that. Do you still, did you opt out of Medicare? Somebody is asking, you opt out of Medicare.
I opted out of Medicare and there's not one day I'm sorry I opted out of Medicare because really like I mentioned in the beginning, how I saw medicine change over 20 years. I find that like the government interference, sorry for my bad, it was like the dumbass things that I had to click the boxes. I am like, this is such a waste of my time. And I feel really strongly about that. I'm like, I want nothing to do with any government, any medicine, forget about it. So I opted out, no brainer.
Okay, got it. Yeah. Do you think, now let me ask you a few other questions if other patients will ask you, somebody is asking, which EMR did you choose?
Yeah. So I chose Atlas and I like Atlas and I don't want to switch. My MA is always saying we should switch. We want something that does this. And I'm like, no way. I'm not going to like try and transfer charts or anything. There was a learning curve because Atlas is very much set up for direct primary care. And so the billing, it took us, it was such a headache. So if you need help with billing, let me know if you use Atlas. But we had like people who were charged by accident and every first of the month we'd get a call. Why did I get charged? And you have to do a refund. And there was definitely a learning curve to getting the charges on Atlas. But otherwise, I really like Atlas. I do. I think it's really useful. I can e-prescribe. You pay extra for that, but it's not much. And it's been good. I like it.
All right. Somebody asked, do you start with a fee-for-service initial consultation and then decide with the patients whether they need membership?
So we tell patients they don't have to decide what they want to do until after the visit. And that way, if I'm like, oh, you need to come back, you will likely need to come back this many times, then they can decide which one they want to do. The other thing that kind of reminds me of is, I'm like an honest person. I don't try and cheat the system ever, right? But one thing I found is that you're going to come across people who want to cheat the system. So I've had it happen to me a couple times where somebody comes in because my membership price is cheaper. They just want to hear what I have to say. And they say, oh, I'm going to sign up for a member. And then their card doesn't work the next month and you call them and they never answer and they never show up. So they got it for half price. And I've had that happen a couple times and I'm like, and I just feel like it's the cost of doing business. What am I going to do? It's not like I'm going to send them collections. It's just the cost of doing business. But you'd be amazed, like the things that people try and pull, which you never see if you're an employed physician. You have nothing to do with the money side, but people will take advantage, but most people do not. Most people are honest, but occasionally you get that person who you're like, yeah. Or I had one time I saw a patient, I spent an hour with her. And at the end, she said, I can't pay for this visit. I'm like, what? I can't pay for this visit. I'm sorry. And I'm like, what am I going to do? It's not like I'm going to steal her credit card. So I didn't call in any of her medicines, but she got all the counseling and all the information, and then she left. So
I
yeah,
had the same situation, and I think we are not alone. And
yeah,
initially, I was really frustrated. I didn't know what I didn't do right or how should
yeah,
I change those things. And then eventually, I thought about it and I said, you know what? I really don't need these people in my practice. And it's
yeah,
good that we sort out things in the beginning, and I didn't have that disappointment later when I invested much more time, much more money, because it's basically your investment. You are fully investing time and expertise in them. You give them everything because you want to impress them. But some people, like you said, they will take advantage of us, and that's okay. You learn, and then
mhm,
you're gonna have a better idea who's gonna be the next person. And because in private practice and in employee position, we don't have that struggle. We have absolutely no idea who pays what they pay, and we
mhm.
don't have an idea if they value us or not. And you just have to learn and move on, and it's going to be okay. You're going to gain. I say to myself, I'm going to gain from another patient much more, and this is happening all the time. Now, do you think we have a few more minutes here? And do you think we specialists, do we have to amplify our voices? Do we have to be more vocal about what we are doing? And how should we do that?
Yeah. So I think that's an incredibly important piece of marketing, because like you mentioned, they don't understand. They're like, what do you mean you don't take insurance? Or what is direct care? And so, you know, part of, it's kind of like, a rising tide lifts all boats. People need to know about this. And the more people that are doing it, the more people be like, oh yeah, my friend has a direct care doctor. Oh, she says this. So it's super important that we all spread the word. And, in my marketing side gig, we always do some piece on people's website about what is direct care and why it's valuable. So yeah, definitely we need to spread the word and make it the norm. So, because still and I've seen it over the last 2 years, I've seen so many people join, right, in the direct specialty care and direct primary care, but still we're not there yet. People they don't know.
I agree.
So,
So for those of you that do not know, um, I have created a website for direct specialty care where I started to put, information there. I created an online course for you guys to try to understand how it is or what it is to be done and the steps that you can take. It's just a framework, but you have something to begin with. I don't think me or Dr. Lean had that. And the other thing is I created a YouTube video for patients that you can share with them if you don't have the time. And I know it's difficult to put your face there, believe it or not, it's very difficult to be there visible and to say, things that you think will resonate with them. It's difficult. So I created that. Just share it with your patients. It's going to be easier for them to understand. Or you create one for your practice. But use that example if that's helpful for you to make people understand, because we as physicians, we know our struggles. Patients, they know their struggles, but they need to hear how can we help them, where are we in this process, and they have to see that we are on their side and we are not on the other side of the road just waiting for them to come, charge their money, because that's the idea, that here's another doctor that wants my money and I pay to my insurance. And you just have to bring them that, that value, that expertise to their needs and see that you want to help them. Can you give these people that are here and others that will watch your video, can you give them a piece of advice that you would, I know it sounds kind of standard, but a piece of advice that you think would have helped you or could help them if they are considering direct care or if they are in direct care?
yep. So I think that being an entrepreneur and starting a business is an emotional roller coaster. because I think, and you just have to accept that, right? The path to success is not this, it's this. Like, that is so true. And there are days, still today, there are days nobody calls and I'm like, oh my God, where is everyone? Oh my gosh, it's not going to work. Oh, nobody's calling. No one's going to come see me. And then the next day we get like 10 calls. So I think stay the course. And the other thing I think is be creative. And if something's not working, change it. Don't be so set in this is how it has to be done. If it's not working, change it. Or you're like, well, I don't know if that's going to work. Do a pilot program, try it out. If it doesn't work, you can go back. You don't have layers and layers of middle management telling you what you can and can't do. And then one thing I see a question on the side there. One thing I want to say about that, it says, do patients pay at the conclusion of their visit or what? And yes, because the last thing I want to be doing is chasing people around trying to get them to pay. And the way that I look at it is like, you go and you buy clothes at wherever, you pay. You get the clothes, you pay. And I know like lawyers and accountants will bill you, but chasing down invoices and like trying to get people to pay, that is a nightmare. I mean, we occasionally have people whose, their credit card got hacked and then the card doesn't go through the automatic charge and we have to try and get them. It's very hard. So they should pay. And somebody said, why not charge when they book the appointment? I don't do that. And I've thought of that because I have patients who call and they want to be a new patient. And, well, first of all, we don't know, will we charge them $259 or $499, but they cancel. And so you're like, well, should we charge like a fee so they don't cancel? But I've decided not to do that. I don't know. I think it's a lot of money to ask somebody to cough up if they don't know that you can help them.
Yes.
Yeah. And one thing, and they don't want to waste their money. One thing I do is I do like a free 15-minute visit, like a meet and greet. And I think that's really important because patients don't know if they want to spend all that money. And I would feel the same and be like, I can't spend $500. What if I leave there and she couldn't help me? So I do that free 15-minute visit and it's totally worth it. And it helps sell the practice because you might have someone who calls and they're like, oh, she doesn't take insurance. That's too expensive. And then my assistant will say, oh, but she does a free 15-minute visit. You can just meet her, hear what she has to say. We can just schedule you for a free 15-minute visit. And then you as a provider, you have a chance to sell your value, right? To tell her why it's worth her time and money.
I agree. So we will stop here. I'm sure you will be back and we will talk more. I'm very, very, very happy that we connected and you were so kind to give out from your time and knowledge and to share your knowledge with these people here. We really appreciate that. We thank you again. And I would like to thank you to the people that are here and they took the time to invest in their knowledge and grow in this space of direct care.
Can I just say one thing?
Yes, please.
If you want to follow us on Facebook, we're at Evora Women's Health. We have Facebook, Instagram, TikTok, and we have a YouTube channel. So I would love your follow.
You can follow the Direct Specialty Care YouTube channel and the Facebook page. And I'm sure that most of you are in the Specialists for Direct Care group, and come there, bring your contribution there. I think it's very important for all of us to grow, and there is enough room for all of us, and there are enough patients for all of us to grow. So, you should basically help each other and grow in this space because we need you. Thank you so much. I wish you a very good evening, and we'll talk soon.